Namaskar. I am Dr. Murali Manohar. Welcome to Ayurveda Samhita. In this program, you are going to learn about an important topic and some powerful ancient Ayurvedic secrets. These can change your entire life forever.
Breast shape. From ancient times, women have been concerned about the shape and size of their breasts. Breast development is a vital part of reproduction in the human female. Unlike other mammals, however, human females are the only ones who develop full breasts long before they are needed to nurse their offspring. Breast development occurs in distinct stages throughout a woman's life, first before birth, and again at puberty and during the childbearing years. Changes also occur to the breasts during menstruation and when a woman reaches menopause. The development and kinds of breast changes that take place are directly related to age. There are three phases of development: lobule development, which takes place between the ages of 10 and 25. Glandular development, which is under the influence of menstrual hormones and occurs between the ages of about 13 and 45, and involution, or shrinkage of the milk ducts, which begins from about age 35 on. The rate at which breasts grow varies greatly and is different for each young woman. Foundational breast tissue growth occurs most efficiently with the balanced presence of estrogen, progesterone, prolactin, prostaglandins, and GF compounds. Human growth factor hormones. Factors such as heredity, hormonal imbalance, stress, poor nutrition and medications, in particular the contraceptive pill, and the long-standing effects of puberty prevent the bust from developing to its full potential size. Proper care during the adolescent age will prevent this problem. However, at some point after adolescence, the body on its natural course ceases to produce certain hormones, resulting in the completion of breast tissue growth. Breasts contain mammary glands, which are nothing but modified sweat glands that lie over the pectoralis major, chest, muscles and are attached to them by a layer of connective tissue. These glands are divided into compartments and are separated by fat tissue. The amount of fat tissue determines the size of breasts. Since the female breasts are composed of fat tissue, the only reliable way to increase their size is to gain weight, not something most women want to hear. However, there are certain exercises and oil massages, which may correct bust line and supple breasts by improving the underneath muscle tissue of the breast and elasticity of the superficial skin. Please note that these measures are not intended to increase the actual size of the breasts, but to improve their shape. Guidelines and Ayurvedic remedies. To firm and tone the breasts, stimulate circulation with alternative rinses of hot and cold water. Wear a well-fitting bra that enhances the shape of your breasts. Avoid using very tight bras that squeeze and pinch all over breast region. Swimming is an ideal exercise for improving the shape of the breast, especially breaststroke or backstroke. Playing shuttle or badminton is equally good. Lawn mowing or using a hand mill are also fine exercises to improve bust line. Hand rotations and arm stretching are also recommended. Stand erect with your fingers on either shoulder. Rotate your elbows in the air at least 10 times. Then, stretch your arms at shoulder level in front of you and cross arms in a scissor-like fashion and move quickly. The right arm on top of the left and then the left over the right arm. Massage the breasts gently but firmly with Ayurveda Adi Tailam, a classical Ayurvedic medicine formulated by the famous sage Vatsyayana. A regular usage of this oil is claimed to improve firmness and shape of the breasts. While massaging, always work upwards towards your neck using circular movements. Blot out excess oil using a tissue. Two other oils are traditionally advised to get a firm youthful quality to your breasts: pomegranate toner and shatarvari ghee. To prepare pomegranate toner, mix 1 part powdered pomegranate rind, 4 parts mustard oil and 16 parts water in a container and bring to boil. Gently simmer until water is evaporated. Cool in refrigerator until ready to use. Shatavari ghee can be prepared in similar manner, for which the ingredients include 1 part shatavari powder, 4 parts ghee, and 16 parts water. Last but not the least, regarding the size of the breasts, instead of worrying so much about it, I would recommend that you learn to accept and enjoy what you already have. Small breasts are no less its function, because size does not have any bearing on anything. It is like having a small nose, you would not smell any less. It is purely a question of aesthetics, and many individuals prefer the look of smaller breasts. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will meet with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha. Satam Hemantan, Satam Vasantan. Live over 100 years old with excellent health and complete happiness. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.